Hello and welcome. Welcome to the Dr. Lake Show. This is Dr. Paola Lake. Another day here to do a podcast, and hopefully this will be a nice distraction from all the news that's going on. I know everyone is riveted, but for today, I think it's a really good topic because we're going to talk about anxiety in children, and it may be especially relevant today that we are dealing with COVID and lots of changes in schooling for children. And I'm really, really excited to have Dr. Arthur Burrows here today with us. He is a private practice owner of Becker, Burrows and Associates here in BC, and someone who has been doing extensive work with children, registered psychologist, also has worked for years in the school system, within the community, in psychiatric settings, and more recently in private practice. And really, really happy to have you here, Arthur. Welcome.
Well, it's great to be here.
Yeah, I've been looking forward to this, and I just think, especially now with the children, and lots of changes in the last year. I don't know if there's been a change or increase. But before we get started, I want to give a hello to Dylan here. Hi, Dylan.
Hello, Paula.
He's always in the background here, so it's always great to have you. Arthur, I don't know, you've been working, how many years have you been working with children? Sounds like you've been doing quite an extensive amount of work with children.
Well, I hate to age myself, but I suppose I will. I started working with children I actually started out as a teacher, elementary school teacher, and pretty quickly found myself working in a specialized school setting where a lot of our kids were experiencing a range of difficulties. So, over time became counselor, then decided to become a registered psychologist. So I first started working with kids probably as at least professionally in 1987, I think, and did my master's in the early 1993. So from there on, it was sort of the more or less the work I do now.
Yeah, I honestly, I have great admiration for working with children because you're working with more than with the individual. The family is much more a greater part of the treatment process, I'm imagining, when you're working with kids and you're private.
Oh yeah, very very much so. Whether with children, there's always the other two major components of their environment, which of course is their family, and pretty closely for school-age kids, of course, the school system as well.
Right. Just one question, and this might be more of an observational question because I've certainly heard a lot out there about the changes since COVID. Have you noticed any COVID-related impact in the home front with parents and children and anxiety?
Certainly, over the last year, I've noticed, particularly with the parents, much more conversation around how to deal with the changes that the kids and the parents have faced, and concerns about how the kids are doing. There's anxiety regarding globally, what impact this is going to have in the children's schooling, their social development. And then also just, the change of having families spending much more time in the house, and also how to address, kids' concerns around the pandemic and health concerns and so on. Yeah.
And I think for any parents that might be listening to the show, they're going to be listening and wanting to get a sense of how to recognize. And that's one thing I think is a first step, with any treatment orientation, is recognizing that, children are going through problems with anxiety. I'm sure it can be mixed in with other conditions as well. But how can a parent, how do we recognize that children are going through anxiety? What are some of the markers for it that parents can look out for to know that there's an issue to work with?
Sure. Well, I think it's important to first of all recognize that anxiety is actually normal, and I can't imagine being able to raise children without having the children experience anxiety just as adults we experience it. It feels uncomfortable. Typically is temporary and eventually decreases over time. It is kind of a normal part of our system that actually keeps us prepared for actual danger, keeps us kind of aware of what's around us when we're walking, and enables us to react quickly and effectively to immediate danger. Where the real concern is when anxiety stops being relevant at both relevant to the immediate threat and starts to actually interfere in the child's functioning.
Right.
That's kind of the where we move from normal anxiety, which is healthy, to anxiety, which may be impacting the kids. Again, with COVID, with all these changes to the children's routine as well as the adults' routines, we're going to all experience anxiety. We typically don't like change. But as far as sort of when does it start becoming problematic is you do look at where the children are experiencing increased anxiety that's above and beyond really what they can immediately respond to. If it starts to interfere in or change any of their behavior over a extended period of time, children start becoming fearful. Sometimes one of the difficult things is a lot of children will actually become quite quiet, and they can be well behaved still,
Right.
Where others can become disruptive and acting out. So with children, it is a trick. It really depends on the individual child. But if you're noticing significant changes that impacts the children, typically that's when to start to kind of question whether it's becoming problematic. Probably, like I said, when the kids become more disruptive and acting out, it's almost easier that way. So they may become more, well, just like adults, become more easily irritated, less patient, and so on. But for some kids, they can hold it in quite well, and they may, if anything, become more quiet and so on.
So the ones with the behavioral problems that are kind of manifested might be the first ones that come to your office, because it's creating a visible disruption, and perhaps some of the ones that are a little bit more quiet. There could be a possibility that people might oversee that. They might not recognize that as an issue as much.
Yeah, that's quite often that's the group of kids that are harder to kind of identify, and probably the ones I worry about more, not so much because they necessarily have a worse trajectory, a worse progression of into what we would call an anxiety disorder clinically. But more just they're harder to catch. I think the trick is, and this is true to parenting, is being able to have regular, just casual conversations to the kids, find out what they're thinking about. Certainly focusing on the positive things. But if you're seeing the kids sort of regressing from or not as active in things they normally find enjoyable, that would be one of the signs. They're not eating. It really can range from how they're how their physical responses are, what kind of thoughts they're having, their emotions,
Right.
and as well as their behaviors. So it's this is the hard part, and this is where each individual child is different, and
Yeah.
really parents are in the best position to kind of sense. Often
Yeah.
parents will say, "Well, I always knew there was something going on,"
Right.
you know.
Yeah.
So, which is big because, of course, as parents, I often refer parenthood as one giant anxiety trip. So,
Yes. Yeah. Well, one of the hardest things, and this is one of the reasons I chose, I to some degree moved away from working with kids, although I had some experience in my training with them, is because they don't have the verbal skills. They may or may not come up and say, I'm scared or I'm anxious. It manifests itself behaviorally, whereas as adults we can actually articulate it and say what's going on. For children, you're working a lot more with that limited capacity, right?
yeah, certainly, and that is the hard part about working with kids. So,
Mm-hmm.
it's often in the context of just regular play, regular conversations. Depending on the age of the child, just what they do for the very young. The very very young, they're typically going to do as well as the parents do. Basically, sorry to
Okay.
throw that on everybody, but
Okay.
the ones that aren't impacted by the changes in schooling and so on. You're going to maybe notice it in how they play in the topic when the kids are say sort of ages three to or even earlier 3 to age 5, where they often will verbalize their play. You may pick up some anxiety there if there's a major change. But again, it's important to realize whenever there's change for any of us, we will experience anxiety. So the fact that the kids maybe are changing somewhat in their behaviors, their emotions, and so on, doesn't necessarily mean it's a big problem.
Sure.
Because there are these changes. It's when it starts to interfere
Absolutely.
with their development and their day-to-day life skills. As I said, it could be anywhere from biological changes,
Right.
their eating, their appetite, to their behavior. So
Which could
I know
include
that's vague.
Well, I mean, but there's truth to it, right? And I think when we're using the DSM-5, that is one of the major things we're looking at in any condition is it having a negative impact on functioning? And for children, that's kind of a good clue. Like, for example, they're not doing as well at school, would be possibly, right?
Yeah. School again, if they're and this is difficult with the changes and how much opportunity the kids are getting to socially interact. But if they're withdrawing from friends, withdrawing from activities that they used to do, that's certainly a sign. For the ones that are acting out, you'll see perhaps more behaviors of a more defiant nature, lashing out, having short tempers, or even sometimes there's cognitive changes. The children have more difficulty paying attention. A lot of the symptoms that are commonly attributed to, say, attention deficit hyperactivity disorder actually are also signs of anxiety as well, and that's why sort of separating those two diagnoses is sometimes a challenge.
Well, this is a very broad topic, right? When you talk about
anxiety,
it's a huge
topic.
It's such a huge topic. I actually think that this, in some ways, even an hour show doesn't justify the extensiveness about it, because it can depend on so many things going on in the children's life. I actually knew a child psychologist, and one of her I guess observations in her practice was she experiences parents bringing that child into the clinic and saying, here you go, fix my child. And one of the things that was that for her was really an observation was that often that what's happening with the child is happening within a context, and it's not really about only fixing the child. That there's often other things at play that need to be looked at when you're dealing with children. I don't know if you can comment on that. What your observation is around that?
Well, certainly, I agree that particularly with children, and particularly when I'm working with children, I typically have to view it as I'm not just working with the child doing therapy. To be quite honest, although it has its utility, sitting with the children is just part of the treatment. Whether we're doing play therapy or moving up towards more talk with the older kids and so on. But so much of how we support kids with any sort of emotional behavioral challenge, or in this case for a topic anxiety, you need to be aware that a lot of the things that are going to help those kids are really the adults that have day-to-day interactions with them. So whether so it's in the case of anxiety, particularly. If it's impacting school, it's important for the teacher and support specialists within the school to be aware that anxiety is a feature. It helps in a number of different ways. The schools can provide a lot of very, very helpful modeling, teaching the whole class about anxiety, which a lot of teachers do these days. And also sort of making, being aware that, for say a child who is experiencing exam test anxiety, what sort of things can make those exams or tests a little less anxiety producing, and even cueing the child. Say as a therapist, I will teach a technique for the child to do some deep breathing just before they have a test. There's these relaxation techniques that we commonly use. With children, to be quite honest, with adults as well, we often need, it's handy to have somebody remind us.
Yes. Yeah.
And adults may be somewhat better. Before I go and do a large talk now, I know to breathe deeply as I go up to the top of the stage.
Right, of course, yeah.
But for kids, it is good for the adults. To be quite honest, it is probably imperative for the adults working with the child to know that the counselor, the psychologist has taught this deep breathing, what terms we use, because there's lots of different kind of forms of deep breathing and words that we use. So, but for all the adults to know the child has been taught this skill, and and to cue the child when they witness that the child is either in an anxiety-producing situation or showing signs of acute anxiety in the moment. So it's sort of like Johnny, Johnny, let's read together. And if the teacher and the parents both know the terms to use and how to do it, they can reinforce it. And as with teaching any skill, you teach it and then you practice it. And to practice it, you need somebody there to sort of coach you, and until the child becomes independent on it.
So you really need the parents, their involvement in as the children are working through some of their own issues, to be almost facilitators of the process. They're not just left to their own devices. So there is some psychoeducation for parents as well that you will give in that process. Yeah.
It certainly, in my experience over the years working with kids, and when I first started, the treatment model in a number of the systems I worked in was, they drop the child off for 45 minutes with me, and particularly when I was in the school system, they come in during a certain period, and then they have to go to math, the next block, and you if you just do with children therapy in isolation, I think for a lot of things you're going to have limited success. The other component about adults, and particularly families, is just the families' expression and how they process anxiety producing situations like COVID,
right?
Like having our kids at home, homeschooling for a lot of us, trying to get that Zoom lesson working.
Mm-hmm.
So even just how the adults are dealing with anxiety is also a very important factor.
So what happens around, and especially now, because I do think there have been, and I've certainly talked to parents, a big stressor for them is when they've been managing before, at least they could count on schooling as being a form of reprieve for them as they go to work, and now as children are home. What happens with relationship to parents' anxiety and how it plays out in children? And what do parents need to start monitoring? Because I not having had children, the one I remember watching Caesar Milan with dogs, and I always did a parallel. I'm thinking that's exactly what he did. Is he would say what does he say? We train the parents and rehabilitate the dogs. I can't remember how he did it.
But
there was a real inclusiveness there on having to look at the parental behavior in helping children, in this case dogs, but in humans, and parental behavior and their own stress, especially now with COVID. And how to help their children, in the absence of other traumas, let's say, with these inherent stressors that are happening right now. What would you say to that for parents that are going through a lot of anxiety? What could they do within themselves during this period to then start helping their children?
Sure. Well, so it is I'll go back to something when I was a brand new parent. I'll have to put an apology out to my adult daughter now for dragging her in on this. But, she had colic, and we were up in an isolated community at the time, and for any of the parents out there who have experienced colic, they know what I'm talking about. The children are quite fussy, usually starting at the time of the evening where you want to go to sleep, and I don't really have a good answer to why it happened.
Right.
But our pediatrician, who was very much an old school country doctor kind of person, he first of all said the children will do as well as the parents, which I tried to keep in mind. As I said, it's a bit of a anxiety-producing thought on its own, but it is important for parents to realize looking after themselves and attending to their own anxiety is also will help their kids, both in terms if they're calm, their children will be calm or calmer. But also you can model. Children learn by watching. So
right.
So in a sense, with anxiety, and this again goes for the adults as much as the children, it's you want to attend to biological needs. So make sure you're eating. And I'm sorry to everybody, I'm not I don't stand on high moral grounds on this, but eat a balanced meals and ideally regularly. Sort of creating within the home a new routine that has predictability. Use certain anchors that tend to occur at a given time. So meals are a good way to do that. It's very tempting, I think even more so right now, for us to sort of sit down and maybe watch TV while we're having dinner. I and of course I do this
Yes.
sometimes as well, but generally, try to have sit down dinners with the whole family together, get regular exercise, and do take a look at there's a really good website. I don't know if it's okay for me to give it on here. I would imagine it is.
Yeah.
There's a great website that has information both for about anxiety for adults and children, and it's at www.anxietycanada, anxietycanada, all one word, .com.
Okay.
But they have a number of suggestions about how to deal with anxiety, and there's I think what we have to really watch is so anxiety is sort of, if you think of it, we have thoughts that are anxiety producing, and we all have our favorite sort of ones that increase the anxiety more than we maybe need to have them increased. So parents being aware of their own thoughts, their own anxiety. Am I a little shorter with the kids right now? Are they driving me nuts? And so I think a popular one is the kids are driving me nuts right now.
Right. Yeah.
As a thought, and as I say, as a parent, I've certainly had those thoughts too.
This isn't
as a young grandparent.
Yeah.
Sorry?
Well, and I mean, it's also, you're normalizing it, I think, is really important because, we are humans. We go through anxiety. Adults go through anxiety. It's not something for parents to feel badly about. But it's a really good point for them to become aware, just not from a place of any kind of blame, but to recognize just how powerful, the influence of feelings. And it really is around doing what I do, not what I say. And sometimes we can, preach to our children, to be like, or try to not be anxious, but we don't deal with it ourselves. So that is a really important aspect of the work you do, right? Is helping the parents manage their own anxiety, and then it's much easier for children to be able to model that.
Yeah, exactly. And so when if the child is exhibiting, say, more defined behavior than is normal, and I think a lot of parents of young children, say, will recognize that the child's getting basically cranky and maybe it's time for a nap, kind of a thing. So it's sort of being able to reframe the kid's behavior, as opposed to they're driving you nuts, to, okay, what is the child's behavior telling me the child needs right now? Again, because children do not have the language, they aren't going to be able to articulate their needs, but their behavior will communicate a need there.
Right. Right.
And sometimes it's I need a sleep, to maybe this math homework that's been assigned is too much for me right now, and I need a break, or I need help. Often children will say, "No, I'm not doing that." We'll see it as a defiance, where really what they're doing is saying, "I can't do it." It could be they can't do it in terms they don't have the skill, or they can't do it because it's so overwhelming, or so it's causing them so much anxiety that they can't concentrate on it.
Right. Our connection seems a little soft right now, so hopefully.
That's probably because I walked away. That's this.
Oh, the beauty of technology. Yeah.
Yeah.
I think that's really, really helpful. One of the things, I don't know if you've read the book, which I liked, was Raising an Emotionally Intelligent Child. And have you ever read that one with Gottman?
I know of parts of it. I'll confess I haven't read it though.
Well, no, but I actually, this is one thing he said, and I just want to get your take on it. And a lot of what he talked about is the correlates of having an emotionally intelligent child that can start to learn how to verbalize feelings. I remember there was one child that I'd met, and he was the child of two psychologists. I think he must have been like 3 or 4. And I had
Hmm.
never in my life heard a child use as many, be that articulate about feelings and be able to actually say words that, a lot of us children don't get exposed to when they're young. Um, but one of the things that he talked about was how to talk to children about feelings. If they don't
Hmm.
have the words, they don't have a way of articulating, they don't even know necessarily what's going on with them. And
Hmm.
what would be your thought on how could parents broach the issue if they're seeing a behavioral problem in their child? They're suspecting their child is anxious. Um, what role, I know one of them you mentioned is a parent can relate to their child. Okay, we've got some breathing. Let's practice breathing, or can perhaps be that little reminder for that. Is there a way for them to address it? I mean, I'm sure this depends on their age as well, but wondering what your thoughts are on what do parents how can they communicate to their children?
Yeah, well, it does vary depending on the age, but it
Mm-hmm.
is when you start seeing changes in your child's behavior and how they're responding to the environment around them and so on, and you are suspecting that it's some sort of worry or anxiety that's they're displaying. Depending on the age, you can check in. I notice you're doing this. I'm wondering if you've got something on your mind. You're worried, or particularly I think in the context of COVID, because it's something we're all experiencing. It's very much in the news. It probably is important to have a conversation about it. And again, depending on the age of the child, the kind of language you use is going to vary.
Of course.
But it's sort of having a conversation that there is this out here, and for children, sort of reassuring them that there are things we do to keep ourselves safe, and this probably goes to hand washing and so on.
Mm-hmm. Mm-hmm.
Um, but I think it's often tempting for us not to bring this topic up or
Right.
any kind of anxiety producing topic, things that are happening in the family. One of the parents has lost a job or their job situation has changed and they're now out of the house more often or, any kind of change. We worry that by talking about it, it's going to bring it to the forefront and that
Mm-hmm.
the kids are it's going to cause them to worry.
Mm-hmm.
But always go back to parents know their kids, and it's sort of recognizing that you're probably best to address it to whatever level the child is able to understand, and have an open topic to talk about this pandemic or whatever term you use for the child. Is scary for everybody, and it's caused a lot of change. And sometimes change um, can bother us. How are you doing? You know,
Mm-hmm.
um, if that makes sense. And then move the conversation over to what we can do about it. And I think the news is full of a lot of aspects about the pandemic that we as individuals have don't have a whole lot of control over. It is important to go back to what we do have control of, and and even for the individual child, for the adult to be able to share with the child what they can do when we feel we have an actionable plan, something we can do. It tends to lower our anxiety. And again, this advice goes for adults as well. What can we do? Well, we can wash our hands, uh, you know, wear a
Yes.
mask,
Yes.
and so on.
To get a bit of sense of agency that you're not helpless amidst all this, and these are some approaches to protecting yourself and creating safety. So you're focusing really on the what can you do and how can we deal with this as we're dealing this, rather than just focusing on the problem itself. And that kind of anchors
Exactly.
children in a sense of what they can do to make things better. I don't know how much I can speak. I myself have been really compelled by the news lately, and with children at home more. How much should we engage in that conversation? Should they be exposed to a lot of what's going on? As parents are immersed. I know people that have been talking to me about feeling so compelled with all in the news, certainly things in the States, but even in Canada. Should children be shielded from some of that? I know some parents have tried to shield their kids from all of these stress-inducing stimuli, let's say. And I always think, children, we might not talk to them about things. It doesn't mean they don't know something's going on, even if you're not talking about it. But how much is overprotection when we're trying to, and how much do you think is an acceptable amount of exposure for children to be involved in?
That's a great question, and again, it varies in age. Because of course, as the kids get older, they have independent access to way more media than ever. But my general advice to adults would apply to children as well. Is I think if anyone's erring, they're probably spending a bit too much time exposed to the media. So. Right. The younger kids really should be getting their information, ideally, as much as you can from the adults, not from media, and not from, and I'm talking about the very young kids. Mm-hmm. As the kids get older, it is handy, and I'm sorry, parents, for saying this, but I think being aware of what your kids are seeing through media is important. That is no small feat. I do understand that. But so, typically with adults, I'm saying, really, and I've done this myself, particularly in recent couple of weeks. We'll find ourselves just kind of. I heard a great term for it, and I've totally forgotten it now. But sort of almost compulsively checking the news on our smartphones and so on. Really, we probably need to really read the news maybe once, twice, maybe 3 times a day.
Right.
But it is sort of talking about it and giving the kids opportunity to share with you what they've heard, what they've exposed to, and then helping them process it. But most of the time, if you can, it goes back to how do we sort of survive pandemics. I think it's recognizing that our daily routine, the flows of our days, have been interrupted and disturbed. We need to build new ones within the context. So if your kids are at home and not at school, you want to build a routine as if that provides structure to the day. So really, they're only accessing media once or twice a day at the most, right. And then again, depending on the age, making sure that's appropriate. Does that answer?
Yes, absolutely. I mean, I do recall it was a educational program and training on dealing with uncertainty. And I think that applied to adults as well. I mean, it was focused actually on adults, although it applies to children as well. And because this is uncertain, right? We're dealing with a lot of uncertainty in these times, and and restrictions and changes in habits for the adults as well as the children. But one of the things they did say, which mirrors exactly what you're saying, is we need to anchor ourselves in certain rituals and predictabilities of things that we have been familiar with, rather
Mhm.
than throwing it all out. And I would imagine children, to some extent, still require that structure, that protective structure that allows them to anchor themselves in these routines. And so that is one of the things you're saying is, so for example, 9 o'clock breakfast might be one of the routines, or, keeping those in place, even if children are at home, that you still stick to a schedule. Is that what you're recommending?
Yes, yeah.
Okay.
You establish a schedule with anchors through the day that are predictable and again, that's going back to your comment about pets. Pets are
Yeah,
the same
yeah,
way.
yeah.
You'll notice that anyone who has a dog knows the dog knows exactly when dinner time is,
Mm-hmm.
and there's a calming predictability to it. That's quite important. Again, you don't need to over organize the day. You can have
Right. This isn't
planned
military
times
style.
of boredom, for instance. What's that?
I said, this is not military style.
No, yeah,
we're not like, there's no
because
alarm to get up.
we
Yeah.
can go the other way too, right?
Yeah,
You know,
totally.
um,
Totally. Yeah.
kids can be bored.
Yes.
Kids
Yes.
can, and I think it's important. And again, it varies depending on the age of the child. But have unstructured play time, but that can be at a predictable time.
Right. Right. So those are important steps. One of the things I remember with a few of the children I worked with, and this comes back to sort of how we talk to children. Now, COVID is a particular circumstance of that we know that is probably having an impact on anxiety. Then, of course, there's the family system, and certain things that happen within the family that might be contributing. And then, of course, even at school, bullying, right, could be an
Yeah.
anxiety provoking situation, things for children that they feel challenged at school. And one of the things I remember when I worked with kids was sometimes, of course, they don't have the words for things. So you ask them something and they'll go, I don't know, not much. I don't know why why I feel this way. And so part of, if a parent is trying to figure out, and usually I don't know what stage they decide to come to see a psychologist. I'm assuming when the behavioral problem doesn't just go away. But when a parent is trying to figure out what is going on with a child, maybe the child's acting out, or they're really introverted, or they're looking more sad, or and children don't have the words for it. And let's say something is going on at school, or something that's upsetting. And I know children, I've actually worked with some, they're teenagers who sometimes even worry about their parents, or don't want to
Oh, sure. Yes.
don't want to bring stuff up, right? Because they're like, I don't want to upset mom and dad. I don't want to, or maybe just because it's just they don't even think to talk to their parents in some instances, right? And
Definitely. Yeah.
what would you recommend, how when a parent suspects, I think something is going on. I mean, obviously this one step is going to be coming to you, but what would you suggest for instances when there's an acting out, children, the parents have done a check-in, they're going, okay, we're managing our anxiety, okay, we've set things up here in the household well enough, but we don't know what's going on with the child, and they don't have the words to express it, and their behaviors change. What would you suggest for a situation like that?
Well, certainly, what one wants to do is, and typically as school psychologist or a psychologist anywhere, but we'll look for patterns. When does this behavior occur? Does it tend to occur in a certain situation or class of situations? Does it tend to occur more often at a given time of the day, at a certain place, or a task demand? if you can identify patterns, that will tend to inform you kind of what to use a word that's probably overused when it comes to anxiety, but triggers. It's a good
Right,
word.
right. Yeah,
Really,
well, it
what
is. It's
triggers
probably
the
the most
behavior.
precise one we can think of, right? Well,
Yeah,
I
like a
know.
common.
Yeah.
Yeah,
Go ahead.
yeah, I was going to say, if it's sort of behavioral problems at school, does it tend to occur in certain classes and not in others? And again, this doesn't mean that, the adults or the teachers are doing anything wrong, but it's telling us that there's a stressor there that we need to address, and which may include making some changes to the task or the situation that the child is in, but also teaching. And this is the really important thing is, when kids experience problems, behavior problems. This is another whole other topic, but if we see the behavior problem as being indicated that the child needs a new skill to either get or avoid something. With anxiety, it's often, the child either needs a skill to be able to reduce their anxiety in a given situation, or to find a way to avoid the anxiety
Right.
producing. It's a whole other thing. But if we look at behaviors as signs of something that can inform us of what the child needs.
Right.
That's probably the best way I can put it. So we sort of, when our kids are experiencing difficulty, you need to go in sort of investigative mode.
Yeah. Makes
You're
sense.
trying to figure out what's going on. And so you look for patterns.
For patterns. So
Typically,
I've certainly heard parents say, this is one common one that I've heard is when my child returns from if in a parental separation situation, right? My child comes back from spending time with my ex and is unruly and rebellious and angry or acting out. Or maybe the child refusing to go to school or not wanting to go to a particular place. Those are kind of things we're looking for, right? And you're starting, yeah,
yeah, that's a great example because I do get that often, and the concern often is there's something happening at the parent's place that they're coming from, and so on. And certainly, yes, that can be the case, but quite often it is just it is making that transition that can be anxiety producing for the child. It doesn't mean one parent's place is worse than the other parent's place, but they're different, right? And so, but see that as okay, what skill does the child need to be able to make that transition a little bit better? Is there something, and quite often it's making a number of changes. One, maybe changing the way the transition is done, what's expected after the transition, to teaching the child some particular skill in how to manage that stress and so on.
So what
it can, and it can sound very complex, and it can be difficult to do. But on the other hand, the general idea is simple. Is we look at the environment of where the behavior occurs. What happened before, what happens after, and we kind of take what does the child need here.
And so you need to take the time, look at patterns, investigate what it might be surrounding. And then you're really kind of doing some research of your own and trying to see what might be contributing to it, even if they don't have the words for it. And then you can check that out with your child, right? Sort of see.
Yeah, there's different ways of seeing it, but any child who is developed language, that there's different ways, but you basically ask, how are you doing?
Right.
And I noticed this, or do you find that difficult? And kind of validating it. It's like anxiety, when the children are expressing fear or so on. our temptation, I think, often is to try to reassure the child, so you don't need to worry about that.
Right.
And I think one of the a really simple kind of rule to remember with kids, and to be quite honest, anybody,
It is. It's so
you
true. Yeah.
Don't dispute the emotion. You're worried about that. Okay, tell me about that. And try to get an idea what it is about the fear. What kind of thoughts the child is having. Like, well, when I go to school, I don't think anyone likes me. Well, tell me why. What is it that it gives you a thought that no one likes you, and that will give you information. Some of it
Yes.
may be very useful and very obvious fix to, and others may be a little
Yeah.
harder, and you need to get alliance with the teacher or some of the school staff to work out a problem. But always start with recognizing and validating the kids feeling the way they are.
Yes.
Oh, you're worried about that. Okay,
Yeah.
tell me about that.
I mean, I don't even think that can be overemphasized because I know that sometimes it's hard for us to see someone we love in pain. We want to take their pain away. And very maybe well-meaning a parent might say to their child, oh, that's silly. Don't think that, or they just immediately can shut down the conversation in a way, and then the child will be
Mm.
less likely to talk about it, right? So what you're saying is actually, validate it, rather than pathologize it, make it wrong, and then you can then support that child in perhaps picking up some tools to cope with it. And it's a learning opportunity right there, is it not?
Oh, definitely.
Mm-hmm.
And this, this goes back to sort of I think if anyone gets anything out of this, the takeaway is that, our children are going to be exposed to anxiety producing events and situations, some more, of a more intense level than others. And, but part of normal human development is to develop the capacity and the skills to deal with anxiety, to realize there's things that we can do about it. That anxiety is normal,
Mm-hmm.
and with our own with our children as they're growing up, it's I use the analogy for anyone who's taught their children how to ride a two-wheeler. When we're teaching them how to ride a bike, we start off holding the typically, I think,
Mm-hmm.
at least I did anyway. It almost wrecked my back, but
Yeah.
we run alongside them holding the bike, and over time we start to let go and we coach them and they fall and we pick them up and encourage them. Okay, that hurt. Let's fix
Mm-hmm.
that knee and then we'll get you back on the bike. And over time we're holding the bike less and less until we're just watching them ride their bikes,
Mm-hmm.
and for any sort of social emotional skill, dealing with anxiety is very much the same way. We start off with our kids, helping, model the expected behavior, coach them about it. And so much that really is okay. What you're experiencing is anxiety. If your stomach is upset, if you're feeling really grumpy, if if you can't concentrate, maybe do you have other things on your mind? What are those
Mm-hmm.
things?
Mm-hmm.
Okay, that's anxiety. Here's some things you can do about it.
And
Again,
yeah, go ahead.
sorry, the Anxiety Canada website is a really good place for parents to access some information, both for their own anxiety as well as
Yeah.
uh,
Well,
as,
Gottman, one of the ways he called it emotional coaching, but it was directed for parents really, because
yeah.
I've met, I work in the adult world, but and teenage perhaps, and I've met certain people that have grown up in families where emotions are not talked about, and it's much more difficult for them to even know, even as adults, how to articulate their feelings. They've
Mhm.
perhaps spent a good part of their childhood not really talking about feelings and dealing with it all by themselves. And at least from the perspective, clinical perspective of what I see is that they didn't have those opportunities when they were young. And maybe well-meaning parents have been to try and protect their children. And the thought that sometimes when we talk about something, we're making it worse is actually not the case, right? That we can actually reduce anxiety by being able to put it into words and articulate it.
Exactly.
What is the most common, what are the if you were to think, and I know some of this might be hard because there's so many different scenarios, but what do you think is the most common and effective, simple tools a child can be provided with to help them incorporate into their coping repertoire as they get older? Do you have any one or two that you notice as being kind of good essentials for kids to learn in their childhood to manage their feelings?
Well, I think, with anxiety, particularly when the kids are young, it'll manifest itself most often biologically, or that'll be the thing that the kids come up. And to be quite honest, a lot of adults as well. So stomach aches, these are all physiological reactions to anxiety stomach aches, that kind of nervousness, nervous energy, muscle tension with headaches often. For anyone, being able to manage those physiological reactions, which are natural and are really designed to protect us when we're being attacked by predators. It's quite a primitive system. But managing the physiological first is often it's a good skill. Again, breathing. So relaxed breathing is a technique that we do, or calm breathing. It's got lots of different names, but basically, tends to be something along like you take a slow breath through your nose for about 4 seconds, hold it for 1 to 2, and then let it out for 4 seconds, and then pausing for 2 to 3 seconds, and doing this about five or so times, maybe even 10 times. And that just centers, it causes a physiological reaction because we're breathing as if we're relaxed. And interestingly enough, we can relax our thoughts and our anxiety by relaxing first our body. Add in muscle. I typically, the simple one I say is breathe, relax your muscles as you breathe out, wherever you hold your tension. And then slow, which means just try not to feel quite as urgent or rushed. Again, depending on the age of the child, how much you talk about that. I would just focus for the really young ones, just the breathing. And you can either do it as a song, but you would want to practice it with them and demonstrate it to them and so on. This is a technique I use every time I get in the car to drive to work.
Wow,
so,
yeah.
That's
modeling.
Right, yeah. So, and again, this is helpful for the parents as well. So, I know, for an example, with parents who have small children and the kids are just wound up and they're running around like banshees, in the kitchen, and the parent is aware that the kids are driving me nuts right now. Bring the kids in and say, do you want to learn a trick? I'm going to show you how to breathe. Some way to breathe when we're feeling really kind of energetic and crazy, and kids do need to have that run around time, but and then you do the breathing.
Yeah.
Or another trick is for anxiety is to identify things that are in your environment. So what do you see? What do you hear? What can you touch? What can you smell? I think I've got all those senses now. Do I? Anyway, and that can be a game that actually calms the kids, but teaches them how to ground themselves in the here and now. When we're having anxiety, quite often it's because of thoughts, such as what happens if, what will happen if. What will happen if the kids at school don't like me? What will happen if I don't pass that test? What will happen if something happens to mom and dad? So we can't have those thoughts if we're focusing on the here and now. Right. So again, that could be a skill that we teach our kids. And we can do it when they're feeling anxiety, or even just if they're driving us nuts.
Right.
Let's play a game.
Yeah.
What are 5 things you can see? What are 4 things you can touch? What are 3 things you can hear?
Wonderful. And that's those
all
are.
Of this, by the way, is sorry.
They're mindful tasks. Bringing you completely into the present moment, and in a way, moving them away from the rumination of where their mind is going. Right. Yeah.
Exactly. Again, it is a very broad topic, anxiety, and specific ones depending on the age you modify. But there's again a lot of information that parents can access on anxietycanada.com. Who I'm not associated with, by the way.
Right. Which is that's fine. And I actually like to provide people with resources and suggestions for where they can go. And perhaps if you ever down the road you wanted to narrow it down to something a little more specific, I'm sure there's very unique issues involved. For example, when parents are divorcing, or if a child experiencing bullying, what are some things that need to happen? But right now we're kind of getting just a generic sense of what anxiety is and how to manage it. Just one more question, and this is tied to a lot of my work and among many things, but one of them has been hypnosis and visualization. And I remember watching, this is an older movie. I'm not sure how much of the younger generation has seen it, but do you remember The Elephant Man? Do you remember, did you ever see that?
Yes.
And I just remember the scene where this, child would go through excruciating pain, and the mother would sit with him and walk him through a visual technique. I know children are a little bit more in the alpha theta, sort of neuro, what's the word for that? When alpha theta, brainwave. So their ability to fantasize is a bit bigger. They have a better visual fantasy world than we do as we become more adults and get more concrete. Are there, and I've seen also at schools, they're incorporating things like mindfulness. Are there some specific tools for kids? If can they incorporate things like visualization and meditation? Because they've been starting to do that. Have you noticed anything around that, Arthur?
You know what? I have noticed that particularly in the schools, they are starting to address anxiety and do these visualization and calming techniques and so on. Increasingly, be quite honest, it's still probably hit and miss on that. But
right.
First of all, this is a skill that I think is an important skill for children to be taught,
right.
And it can be taught by the parents and the schools. There's lots of different kind of versions of the programs, and I'm not aware of research that really differentiates between them. But definitely kids can, with some kids who suffer nighttime anxieties and so on, and this is actually my poor parents had to suffer through me going through a stage I remember where I had a terrible fear of not falling asleep.
Wow.
And quite a young age, probably around age 8, I think. I can't quite remember, but I remember sort of checking behaviors. So I would go over to my parents' place or to my parents' room, wake them up, of course, and ask them if I'd been asleep. I'm sort of amazed I made it through that stage alive.
Oh, wow.
But this fear was quite real, and what ended up somebody teaching me was, if you can't sleep, make your favorite dream.
Nice.
Imagine a dream. And the beauty of it is that instead of lying awake worrying about whether I was asleep or not, I was kind of making the story up in my head. And the trick, you fine tune it depending on the child. But what's your favorite place to be? What's your favorite activity?
Yeah.
Think of that and imagine yourself doing that. So this is something you can do at night, for a child who's having, anxiety at night. So it kind of comes down to what is the actual sort of fearful thought that the child is having.
Yeah,
typically, with anxiety, especially problematic anxiety, it's a specific group of thoughts. So, but yeah, mindfulness, meditation, those have been shown to be quite effective. And I'm not an expert in teaching that to children.
Sure.
But there's lots of good material out there.
And we're working with a decreased attention span, and we're working within a context of what children are capable of course. But I think it's a way.
And every child's different.
Yeah, and it's a way of capitalizing on kind of those inner resources they already possess at that point. But I think this is a great. You gave some great ideas, Dr. Burrows. I appreciate your taking the time to share that with us. I don't know if there's any final comment you want to make about, or a summary statement you'd like to make about parents and what would be one primary recommendation you might give them at this time for managing their anxiety.
Well, I think it's that, anxiety is normal, and certainly, children come into this world with different sort of baseline anxiety levels. We're all slightly different. Certainly there are anxiety disorders, and when it starts interfering with their development and their day-to-day functioning, certainly get help. You don't need to be by yourself on this. But do sort of trust that that this is something that you can help your children learn to deal with, and there is a lot of different techniques out there, and as parents, you are a big part of helping the kids learn how to manage their anxiety, so that it helps them, it doesn't hinder them.
Mm-hmm. Wonderful.
So I think that would be my final takeaway.
Thank you. I really appreciate your taking the time today. I think this was so valuable, and I certainly would hope, and I hope to invite you to do some other shows, and perhaps we can hone in on some specific issues that children do go through, and how to navigate them, like a divorce and that. But this was wonderful. Conversation, and I appreciate your taking the time, Dr. Burrows, to share with us your wisdom, all your years of work. I'm sure it's got its challenges, and your contribution too to the community. So thank you so much for joining us today. I think we covered it. I think we pretty well did a really good job on summarizing what we could on such a broad topic, and then perhaps we'll get a little bit more in depth with some topics if you're interested down the road.
It'd be more than my pleasure to do so. Yeah. I've really enjoyed this, Dr. Lake.
This has been great, and so we will talk soon. Thank you very much, and until next time, I hope you have a great day today and get to relax. This is still mid-morning here.
To all your listeners too. Yeah.
Thank you. Take good care, and Dylan, thank you too for being here. Dylan might not be fully present, but I do want to say one thing for anyone that wants to submit. Hi, Dylan. Thank you, Dylan, for being here. I was saying, but anyone who wants to submit any suggestions, even if it is around children and any topic in particular that you're curious about, that can be something I'm more than happy. Feel free to email it's podcast@drlake.ca. That's podcast@drlake.ca. And I just want to say thank you for tuning in here, and I'm wishing you all the best, and take good care with your children. Remember to talk with them and give them tools. You make a huge difference in their life. All the best to you.